What to do if your dog is vomiting yellow bile? A pet's illness will cause anxiety in every owner. The pet refuses to eat, becomes lethargic. All these are weighty reasons for concern. But the sudden unusual vomiting is especially frightening. Why does a dog feel sick with yellow bile and how to help a pet? Why does a dog vomit yellow bile? The presence of foam in the stomach of an animal is absolutely normal. The walls of the stomach produce a special mucus substance, and inside it there is always a little gastric juice, which contains proteins and mucopolysaccharides. When a dog swallows air while eating, it reacts with gastric juices to form a foam. Normally, it is white. Possible causes of the ailment. If your dog is vomiting with bile, observe the frequency of gagging. With a single nausea and the absence of accompanying symptoms, the likelihood of a physiological cause is high. If the seizures persist, and the condition of the animal is rapidly deteriorating, go to the veterinarian. For what other reasons does yellow vomiting occur? If the four-legged pet vomited once, and after a day he looks completely healthy, don't worry. The reason could be foreign object in the stomach, stress, overheat, hunger, food intolerance, binge eating. If the pet has repeated bouts of vomiting, they may be associated with poisoning, helminthiasis, infectious diseases, cancer, stomach and intestinal ulcers, pathologies of the liver, liver failure, cholecystitis, and kidney, renal failure, hepatitis, diseases of the stomach, gastroenteritis, gastritis, and pancreas, pancreatitis, intestinal obstruction. Also, the release of bile can be explained by prolonged drug treatment. Only a veterinarian can determine the exact cause, so do not delay the visit to the clinic and do not try to solve the problem yourself. How can you help at home? In the absence of new attacks and maintaining good health, it is enough to limit yourself to a hungry diet. Leave your pet without food for half a day, making sure you have enough water. In case of multiple attacks, it is better to entrust the treatment to a veterinarian. Before examination, exclude feeding and replace water with ice cubes. Do not try to stop nausea with antiemetic drugs. They can lubricate symptoms or worsen a patient's condition. Veterinarian visit and treatment. To make a diagnosis, you will need to pass blood and urine tests, as well as undergo an ultrasound scan and X-ray. Depending on the results obtained, the veterinarian may order other laboratory tests to identify the pathogen and the location of the problem. Preventive measures. In the pet's illness, the owners are often to blame for not following the recommendations for care and feeding. To avoid unpleasant consequences, adhere to the following tips. Follow the vaccination and parasite treatment schedule. After the introduction of the vaccine and the quarterly administration of anthelmintics, the risk of infection is minimized. If the dog gets infected, it is guaranteed to avoid complications. Include medicated foods in your diet if you have chronic diseases. With such feeds, the number of relapses can be reduced to 0. Train your pet in band commands. This will help to avoid swallowing expired food or poison scattered on the street. For added safety, wear a muzzle that prevents contact with questionable substances. Monitor the balance and quality of the diet. Eliminate feeding on small bones and foods from the human table. Do not mix natural food with dry food. Use only fresh food or at least premium feed. Avoid prolonged fasting. Increase the number of feedings by reducing the serving size. Get tested regularly at a veterinary clinic to identify hidden pathologies. Remember that after 6 years or when chronic diseases appear, the number of visits will have to be increased up to 2 times. If you find that your pet is sick of bile, try not to panic and calmly assess the situation. Subject to preventive measures, the likelihood of pathology is minimal. The sooner the doctor discovers the cause of the incident, the easier it is to avoid complications.